America Pharmacopoeia, the new industrial complex called mental health. Recently I have come across some information through research, personal experience, and historical medical of psychiatry. I would like to paint a dark theory as to the connecting points of this information, and you decide if logic is present. This will show a humanitarian issue as well. To begin, the latest information was on the drug cartels and the use of more toxic chemicals used to manufacture, a result of pressure to make certain raw materials illegal in Mexico. Such as ephedrine was used for methamphetamine. Due to this illegal status, manufacturing has turned to what is called P2P process. The result is more negative issues on the body and mind than the old method. Using meth as the example, but could be applied across the board. The war on drugs is a huge failure. In fact, it has created a dirty product, a more toxic product, and obviously a more toxic environment for all of us. We all know the risks. As sovereign individuals, we make that decision to use, or not. It is not anyone else's decision unless you are forced against will. Now, as any business of which drugs are a business, illegal or legal, it makes the most sense as an owner to deliver a product that is the cleanest, most potent, and less toxic for the consumer. Let us think, if I provided this with fewer adverse effects, then the consumer would have a longer shelf life to buy, of course, more products without being removed from the income stream. Business 101, right? Let us think, government pressure equals more toxicity but also creates more jobs, the new industrial complex. Mental health, law enforcement, pharmaceuticals, and so on. Humanitarianism is telling me something here, or the less of two evils, so to speak. Now, some information is saying that the CIA, as we all know, is involved in everything, and always has been, including the possibility of running these cartels. Interesting, is it not? Psychiatry, oh, my favorite subject. 374 disorders, no cures. Let's paint the picture, as above, so below. Ready? Experts say, there is no definition of mental disorder. It's bullshit. I mean, you just can't define it. In order to survive, us psychiatrists must go where the money is. We do not know the etiology of any mental disorder at this time. The drug companies, or cartels of legal drugs, learned a while back that the best way to sell drugs was to sell diagnoses. Selling the diagnosis is a way of opening a new market. We made mistakes that had terrible consequences. For more on that, go to www.cchr.org. Dark psychology is like this. The DSM that is followed is also used by evaluators in the justice system. Example: you are charged with a crime, and you by right want a trial. It is in most cases that by judgment you are to have an evaluation for competency. Now, the testing they use is that lineage of the above DSM, of which has an influence on the decision of one's particular case. Trials are expensive. The government and its programming, which we all by those statistics, all have some form of a disorder in America. Let us all connect the dots here. Mind control? Systematic control that is out of control, or is it? As a certified human rights consultant, slavery is what some are realizing, the human condition. This has been true for millennia, comes in many forms, and we human beings need to awaken to this global reality. Humanitarians, would it not make sense to allow the cartels to have access to cleaner compounds to produce better products to lessen the obvious that I have stated? Or have a program whereas we can have access to pharmaceutical-grade options from the government without prescription, but rather a taxed, recreational program? Gaining access to the control of our society and its sovereign decision to use or not. Alcohol, don't get me started. I request one thing, however this situation turns out. Can we please stop the violence, human trafficking, sex trafficking, and just concentrate on the core business of drugs and its profits? If those three things were accomplished, it would make for better business, safer for our women and children, and probably make all governments less sensitive to the obvious: we have always and will always consume. We are humans. Mucho respeto a los carteles, familia e deseo de una resolución para un negocio más seguro y mayor en el futuro. Gracias.